Hello, my name is Abel Jarell. I am a dermatologist and dermatopathologist, and I am also a clinical trials investigator. I live in Portsmouth, New Hampshire, where I practice dermatology with Optima Dermatology, and I am also the CEO and founder of Strax Skin Research. Our research focuses on patients with early stage cutaneous melanoma. That's stages 1 and 2, where the risk of brain or central nervous system metastasis is generally considered fairly low, but when it does happen, it's associated with poor outcomes. We looked at the 31 gene expression profile, or 31GEP test, and determined how it could help predict patients who were at higher risk. This test classifies patients based on their genetic makeup of their tumor. In other words, it predicts biological behavior. Historically, we've used Breslow depth or even sentinel lymph node biopsy to predict how a patient would do from a prognostic standpoint. The genomic expression profile test, or the 31GEP, over the last several years has definitely proven to be more effective and provide more significant prognostication than anything that has been previously used, namely Breslow depth, ulceration, or sentinel lymph node status. In other words, the 31GEP can predict prognosis of how a patient will do in terms of whether they will develop metastasis, distant-free metastasis, overall survival, and even melanoma-specific survival. And it's on a continuum, the report of the 31 genomic expression profile, which generally reads out in 4 different results. A class 1A is the lowest risk of a negative outcome, or what I listed before, overall survival, distant mets-free survival, and melanoma-specific survival. In fact, a class 1A result has an extremely high negative predictive value in determining that a patient is very likely to do well if they have a class 1A, the strongest negative predictive value of anything that has ever been used in the past. On the other end of the spectrum is a class 2B result, which generally predicts a worse prognosis or lower overall survival, lower melanoma-specific survival, and a higher likelihood of distant and mets-free survival. There are intermediate ranges that are also significant, a class 1B result or a class 2A result, but particularly the class 2B result can portend a more negative result. It doesn't guarantee that something bad is going to happen, but it's much more significant than, say, sentinel lymph node biopsy or even Breslow depth. So again, we looked at whether the 31GEP expression profile test could predict which patients were at higher risk, specifically of developing CNS metastasis. We found that patients with a high-risk result, or class 2B, were significantly more likely to develop brain metastasis. And importantly, these metastases tended to occur early, within about 1.5 years of the diagnosis of cutaneous melanoma. Other clinical features, like tumor thickness or ulceration, were not as strongly predictive in our multivariable analysis at determining whether somebody may develop a CNS metastasis. So the takeaway is incorporating 31GEP into clinical care may help identify patients who could benefit from earlier targeted brain imaging, with the goal of catching metastasis before symptoms develop, which can improve outcomes. These findings build on existing evidence for the 31GEP's role in risk stratification, but this is the first time it's been specifically linked to central nervous system metastasis in this patient population.